Hello. Hi. So today what I want to do today is to demonstrate how to use the slice of kit by actually testing myself, so you guys will see me do it and hopefully it will guide you towards doing it by yourself. So one of the things to do is to put together is just to keep it handy is a rubber band, and this rubber band goes for those who struggle with bringing out enough blood. So if you're not sure whether you would have any problems bringing out blood, keep this rubber band handy, just in case you need it. Then the other thing is a scissors, and that's for cutting. So normally I don't use a surface, but I'm just using this white paper. So that when I do the test kit, if there's any spillage for the blood, it will go on the paper, because I'm actually lying down on my bed, just to show you just how easy this is to do. It doesn't require something very technical. And then this is the Slice Safe pack that contains the kit. So I'm doing this test with the Sunstone, and the Sunstone contains 4 test kits inside them. So let me bring them out. So this is the hepatitis B one. Let me drop that there. And then the second one is the syphilis. Let me drop this here. And then you have the HIV. So there are 2 HIV test kits. One is taped to the back of one. So this is 2. This is 1 and this is 2. So this is the HIV. Hold on. Let me cut it. Let me separate the 2. Yeah. So this is the HIV first test kit. This one, HIV first test. So that's how it's labeled, and this is what it looks like. This is the first kit you use for the HIV, but you will actually use it at the same time. And then this is the HIV confirm kit test, and this is what it looks like. So the reason it's called the first test is because the results from this confirms this one's results, not that you have to do this first before you do this. That's actually not the reason. So now I've lined up all the test kits placed so that I can easily do it. So something else to bear in mind is there's 2 extra pipettes that you will put in your kit. You're going to use it, and then this is that contains the alcohol swab and the lancet. So this is the lancet, and this is the alcohol swab. And then the other thing that this contains is the manual. So you can please read the manual to understand it a little bit better. Or, regardless whether you watch this video or not, still read the manual. There's a lot of information in the manual that is good, that is handy. So let me start the test. So first thing I'm going to do um, is to cut this open to bring out the lancets and the alcohol swab. So this is the alcohol swab. This is what it looks like. Normally you would have 2 of it in your kit, but I just want to use 1 for this demonstration. And then you will have two lancets as well. But for this demonstration, I'm just going to use 1. The reason we put an extra one is just in case you're not able to do all the tests at the same time, or you have some kind of accidents and you need another one, because you really need to use this for the testing rather than using any homemade, maybe methylated spirit or any of that. You shouldn't do that. You should only use this one. So the only extra thing you're bringing in, like I said, is the scissors and the rubber band or pipette if you have any extras at home. Okay, so now we start with the kit, with the testing. So first thing is to tear open this packaging to bring out the strips. So this is the hepatitis B that I'm opening up. So this is what the hepatitis B test strip looks like. It's just a very slim stuff. So one thing to notice is that it has a black end. So this white end, this is where your blood and the buffer solution goes into. So this is where the buffer solution is in this microtube right here. So I normally like to keep it label attached, still taped to the packaging until I'm ready to use it. So I'm going to leave it here. And then this is for the syphilis as well. Let me open it. So what is in the syphilis is you have the strip, the test strip. Again, this is the white end. This is where the blood sample goes into. And then the yellow end, this is the, and just to help you distinguish between which is syphilis and which is hepatitis B because they are from the same manufacturers. So this is the buffer solution that is inside the microtube. Also, I leave it in it. And then this is the HIV first kit. So I normally have to cut open to remove the buffer solution from it. This is it. So I'm going to leave it here. And then how to open this kit is there's this the green end. You do it like this so that the green, oh, there's a tip on across it, sorry. So once you do it like this, it opens. So all you then have to do is to peel. Okay? You peel from the green end. Sorry. So that's it. I've peeled it from the green end and it exposes it like this. So this white end of it is where um the buffer solution and the blood sample goes into, this white end. So that is the one that has the arrow pointing up. So this is where you put in your blood sample and your buffer solution. And then finally, the HIV confirmed test. This is what it looks like. Okay, this is where your blood, I don't know if this is visible. This is the sample well in here. This is where your blood and the buffer solution goes into the sample well. So I leave the buffer solution taped to this so that it's easier for me to identify. I don't want to make the mistake of mixing up uh, the the buffer solution with the wrong kit, because if you do that, the likelihood of not getting the correct results or not getting a result at all is very high. So inside the hepatitis B and the syphilis packaging, there is extra pipettes inside it. So you need this to bring out the buffer solution. I mean, I use it for the buffer solution. So altogether, I have like 4 pipettes for the 4 test kits. So I start. So I've already washed my hand, so I don't need to wash it again. But when you're doing your own test, remember to wash your hand before you start. And after you've done that, the next thing is to use the alcohol swab to clean your hand, your finger, the fingertip where you want to use. So I want to use this finger for it. Like as I mentioned before, this rubber band is very handy for people who struggle with bringing out enough blood. So what you want to do is you take this and you wrap it around your finger. When you wrap it around your finger, you will notice that the fingertip becomes engorged with blood. So by the time you prick and you remove the rubber band, your blood will come out a lot quicker with this. Another thing to do is to take a warm cloth and wrap around your finger tightly because it helps in improving blood flow. So I'm going to take out the blood by pricking my finger. Sorry, I need to, yeah. So I need to prick my finger. So you can either prick the tip of the finger or you can prick the sides here. So I'm going to prick almost close to the as in the side, but close to the tip. So you use the lancet for it, and this is how you unscrew the lancet. You just screw, 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 and it comes out. So it's a tiny needle here. I don't know if you can see it. You can see it? Yeah, it's a tiny needle that you use for it. So what I normally do is before I do that, um, take the alcohol swab and clean, clean the fingertip that I'm going to collect the sample from. Let's clean, 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 clean. Yeah. Next thing is to take the lancets. So what I normally do is I'm quite scared of needles, so I don't like pain. So what I do is I just press the tip of the needle to the skin, right? I just press it and then gently keep on twisting, twisting. So this way the needle keeps going into the finger without being painful. So I just keep on twisting and twisting and twisting. So I need it to go in so that the blood, it needs to get to the capillaries or at, yeah, I think that, yeah, so let me not get technical with this. So it needs to get in so that the blood can come out properly. Like I said, just gentle twisting, and that's it. So you can see is in. So twisting, and then it comes out. Right. And then you squeeze to bring out blood. Right. So the first one, you wipe it off. The first blood sample that comes up, you need to wipe it off. And then the next one, you then need to do it. So before you do this, remember to keep the buffer solution handy, because once you do that, the next thing to do is to bring it out. Or alternatively, bring it out, get your pipette and put it in here, suck out the buffer solution. It's all sucked out now and waiting in the pipette. So now let me squeeze in the blood onto the test kit. Sorry, I delayed a little bit in bringing out this blood, so I need to do it again. Twists. Twisting in. Twisting in. Okay. Yeah, so I have to do this again. Bring out enough blood. Yeah, perfect. And then I put in the buffer solution. Then I do the same thing for the syphilis. I bring this out. I use a fresh pipette. Get the, and then put the blood sample, and then the add this. So this also, Drop the blood sample, and I drop this in. And then the final one is the final. Fine. Sorry, my head was covering this. So sometimes it doesn't enter with, especially with the sample well, it doesn't enter very properly. So you need to use the fluid to push it in. Yeah. So that's in. I'm all done with this part. So the syphilis and the hepatitis B have actually, the testing has already, the result is already out. So I'm going to show you. This is the results, if you can see. While I was doing the everything is already out. So this is, I don't know if you can see this properly. You see this line? See this line at the top? And you see it? Okay. So this line means that is a negative. So if it's two lines you see, it means this is a positive reading. If it's plain, if it's white, nothing happens to it, that means this is an invalid and you don't want this because you won't be able to use the kit again. And also for the syphilis, the result is also out and you can see it's one line at the top. This means this is a negative. So the two HIV kits are still testing. uh, so let's just give them some time while the result is coming out. But the result for the syphilis and the hepatitis B comes out almost very immediately. So like I mentioned, do not mix up the test kits in the sense that do not use the wrong buffer solution for the wrong test kits, because if you do that, it won't read. You would have an invalid result, and you want to avoid that. So what I did with this one was to, what you know, once I dropped the blood, I then used the pipettes to bring out the buffer solution, and then using the pipette I drop it. So how I did it was just to open, because this is the microtube. I don't know how clear it is. So all I just did was just to open it, and that's that. So I'm waiting for the results of the HIV. Um, the first test is almost out. Let me show you. Can you see? Can you see that white line at the top? So that is it means it's a negative. If it's a positive, it will be two lines, one at the top and one at the bottom. So it's a negative, so this is fine. So this one is almost out, but I just want it to come out a little bit clearer, so that you can see it, because it's very easy to do. If you actually time from the time I started doing the test to the time the result comes out is actually less than 10 minutes. But for the hepatitis B and the syphilis, you can actually wait for up to 30 minutes to 60 minutes for the result to come out. So if it doesn't come out within usually within 5 minutes, just give it some time. It will still come out. And then also for the HIV, the result normally comes out in 10 to 15 minutes, so or even a lot shorter. If it doesn't come out in 30 minutes, then that means it's an invalid result. Then this one is almost good. You can see this is very faint though. So, but you can see there's a stroke at the C top, at the C parts of the kit. I don't know how clear this is, but that means this is a negative reading. If it's two at the control and at the test kits, it means this is a positive reading. If the stroke only comes at the test but not at the control, is an invalid result, or if it's just blank, if it doesn't show anything, is an invalid result. But now there is a dash at the C, that is a negative. So sometimes the lines are not very clear. Like if you can see, the syphilis one is very clear, so it's very clear, you can't miss it. But the sometimes the HIV is very clear, and sometimes it's faint. It doesn't really matter whether it's faint or not. It's still red. It's still a valid result. So that's for doing the tests with the SliceSafe kit. This demonstration I did was with the Sunstone. The only difference between this and the Sunstone couple is that you have two of each test kits. So for two people to do the testing at the same time, or for one person to do it this time and then do it the other time. But the most important thing to note is that the buffer solution is very volatile, and if you keep it in the one place where there's heat and everything, it will evaporate. So please, if you're not ready to use your kit as soon as it comes, try to store it in a cool place, so that your buffer solution doesn't evaporate. It's really, really important, because it will be quite very disappointing if when you're then ready to do the test, you find out that this is completely empty because the buffer solution has evaporated. So please be mindful of that. So all my results are done. I'm going to take a picture and then post it on Facebook. All right. See ya. Bye. So if you're still making a decision about doing this and doing this on an ongoing basis, I hope this has taken care of that. Bye.